Hey everyone, this is Derrick Broze of the Conscious Resistance Network, and today I'm going to talk to you a little bit more about coronavirus, COVID-19, specifically Event 201 and some things you need to know about, because, this is the topic that it's on everybody's mind right now. People are trying to figure out what it's about, what it's going to turn into, and I think I would be remiss if I didn't share the information with you guys that I'm finding, but also I do want to make you aware, and just to be certain, I have probably a half dozen or more other videos that I want to cover of important topics. And I do want to recommend that if you don't watch Freethinker Radio, which is my weekly podcast that airs twice a week via YouTube as well as on 90.1 FM in Houston, that is where I cover a lot more stories. We cover a lot more news, things that I don't typically just make individual videos on. But if you want to get caught up with lots of other news and events happening, I would recommend checking out Freethinker Radio on Friday and on Monday via the YouTube channel, our Periscope channel, our DLive channel, or you can always listen at kpft.org/listen. But I also want to remind you guys to bookmark us on minds.com, steemit/DTube, Discord. Follow us on our text list. This is our quickest and easiest way to get updates to your phone without relying on social media channels. I text you directly. You can also follow us or support on Patreon and, of course, BitChute. Finally, come vote over here in our poll. Are you changing your daily habits because of COVID-19? All right, so let's get right into it, guys. We've talked about this previously in our past videos discussing Event 201. If you haven't seen my videos about coronavirus, I'm going to just recommend go back and watch yesterday's social distancing and forced quarantines, but also go back and watch from a few weeks ago or from last month, I think in February, my video on the coronavirus blowback, I think is what it was called. And we discussed in there the Event 201, which was by now an exercise that you've heard about, organized by the World Economic Forum, the Bill and Melinda Gates Foundation, Johns Hopkins University, and others. And this discussion has been going on in the quote-unquote conspiracy truther circles, right? But lo and behold, yesterday, Friday, March 13th, the World Economic Forum actually kind of acknowledged that people are asking questions about this in a way, and it's really weird. And thankfully, the comments on here are people calling them out. What a coincidence. Yeah, right. Global pandemic. What a surprise. Another drill, just like on 9/11. Plandemic. The D&D session turned out to be a Black Mirror episode, eerily similar to the military exercise that occurred on, yep, you guessed it, September 11, 2001. Yep. So people are really recognizing what's going on. But check this out, just this little piece of the World Economic Forum's video kind of acknowledging Event 201. Check this out.
These epidemic events are getting more and more disruptive to health and to economy. And the reason we called it Event 201 is we knew eventually one of these days, one of those events would be the big one. And that big one would really challenge our capacity to respond. And to respond to the big one, we do need to have all hands on deck. Participants are confronted by a hypothetical scenario that presents to them the challenges of a response. So we will say, here's a hypothetical disease outbreak. This is the way it might be evolving. And these are some of the challenges that you'll see that you'll have to address to address the disruptions that you're seeing to your healthcare system or to your organization.
All right, so we're going to pause it there. If you want to watch the whole video, of course, everything that I'm about to show you will be in the show notes, and there's some important information we're going to go over. But isn't that crazy? They're just like, oh, a hypothetical disease. Conveniently, in this 3-minute, 37-second video, they do not mention that the hypothetical disease was a coronavirus. They do not mention the calls for censorship. They do not mention pretty much that the Event 201 predicted and discussed everything that we see unfolding right now. That's why this video is called Event 201 Unfolds. And as you may have noticed here a moment ago, if we go back a little second, he said this calls for global cooperation, right? Let's just check that one out again.
Events would be the big one. And that big one would really challenge our capacity to respond. And to respond to the big one, we do need to have all hands on deck.
So all hands on deck is basically code for global governance. You know, I think most of you probably see that, and here I'm speculating, right, technically. But if you know their plans and if you've been paying attention for a little while, you know that that's what this is all about. We've speculated that all it would take is another 9/11, a terrorist attack, or maybe a cyber terror attack that they've talked about for a while. But in this case, it is a pandemic that is being amplified and is killing and harming people. I don't know if you guys have seen that there are some of the side effects that are for people who survive the COVID-19 are having lung scarring, kidney scarring, and in some cases they're being made sterile. Their reproductive function is being affected. That could be a side effect or maybe a direct effect of this illness. But it's important to understand that that's the goal, is to establish a global government, and the World Health Organization, the United Nations, and other organizations are pushing for that. So let's go through this. This was just posted yesterday, Friday the 13th, World Economic Forum, March 13th. So a lot of things happening yesterday and in the past couple days. And here we go. There was also a press conference from the World Health Organization on Friday the 13th. Don't let this fire burn. Updates from today's COVID-19 World Health Organization briefing. And I haven't got to watch this whole 43-minute video. If anybody wants to take time for it today, do so. I got to go out and find some toilet paper. And maybe there's some tidbits in here that we need to hear about, because usually the 5 key takeaways aren't going to tell you, the things that they don't want us looking at. But there might be some important details that we need to know in this 43-minute video. But even in the 5 key steps, it says World Health Organization Director General Tedros Adhanom, I don't know how to say his last name, apologies, explained that the virus has continued to spread and that Europe has become its new epicenter. Still, he said measures could still be taken to fight the outbreak. 1, prepare and be ready. Every person, healthcare worker, should know the signs and symptoms of the infection. Detect, protect, and treat. Tracing the virus, transmission of the virus is essential. Reduce transmission. Efforts to limit travel and cancel large events should be time limited based on local needs and reviewed on an evolving basis. Innovate. Says while hygiene basics and social distancing will remain important, finding creative ways to reduce transmission and increase capacity for healthcare systems. And give. At the briefing, officials announced the launch of the COVID-19 Solidarity Fund, a way for individuals to make donations and help with the purchasing of equipment such as masks, gloves, and hospital gowns, as well as contribute to investment research. So that's the big news of the day, is they announced this COVID-19 Solidarity Fund. So let's look more into that. This is from the World Health Organization's website. What we were just looking at was the World Economic Forum. And remember, the World Economic Forum are some of the folks who were involved in this event 201. That's why they're now kind of coming out and open about it, because people are questioning it. The World Health Organization, United Nations Foundation, and partners launched first of its kind COVID-19 Solidarity Response Fund. Now, there's not a whole bunch important into this other than that they are getting philanthropists to contribute probably to vaccines and other efforts. This is being created by the United Nations Foundation and the Swiss Philanthropy Foundation together with the World Health Organization. And guess what? They already have support lined up, including from Facebook and Google, who have instituted a matching scheme to fundraise through their platforms, while individual donors can visit this website to learn more. And again, Elizabeth Cousins, UN Foundation President and CEO, says, quote, "We can't ignore the fact that this is a truly global problem, one that requires truly global solutions. The case for global cooperation could not be clearer. Communities everywhere are affected, and people want to contribute. This new fund will create space for people everywhere together to fight the virus." So they're going to raise a bunch of money that's going to go towards funding vaccines and other things. The WHO and its partners are seeking financing for protective equipment to equip diagnostic labs, improve surveillance and data collection, establish and maintain intensive care units, strengthen supply chains, accelerate research and development of vaccines, and take other critical steps to scale up the public health response to the pandemic. All right, and look, I know if you're somehow just a normie, and I don't mean that in any kind of derogatory way, somebody who isn't into this type of research, and you're hearing this and you're like, well, Derrick, that makes sense, right? Why shouldn't these global organizations come together and fund vaccines and fund other preparedness measures? Why shouldn't they do that? Isn't that a wise thing to do? Again, if you are just tuning in, you might not be aware that the people who run these organizations, the people who are involved in the World Economic Forum and Bill Gates Foundation and United Nations, they have wanted to seize power for quite some time. And they're also eugenicists. They believe in population control and other methods. Here's where you can donate to the COVID-19 Response Fund, Solidarity Response Fund. And as they say, it'll go to work and track to understand the spread of the virus and to help get supplies and to accelerate the efforts to develop vaccines, tests, and treatments. Now, also the FDA making an announcement on Friday the 13th. FDA gives flexibility to New York State Department of Health issues emergency use authorization diagnostics. So what we're seeing here is just, they're accelerating the push towards getting an answer, getting a solution. And in their solution is going to be a new vaccine, which has already been worked on by companies, some of the who's who of people who are involved in big pharma vaccine industry. It's almost like they were prepared for it. It's almost like they ran an event 201 6 weeks before this actually took place and had some time to get prepared. And now they're coming out and talking about it. It's pretty interesting. Then you got this Business Insider. This is the other big piece of information. The World Economic Forum and the World Health Organization are launching an emergency coronavirus task force of 200 business leaders, including executives from Alphabet, who owns Google, and others. World Health Organization and the Economic Forum are launching an emergency task force. It's called the COVID Action Platform for Business and has more than 200 corporate members, including Alphabet, NASDAQ, KPMG, HP, Bank of America, and others. Some of the group's initial plan include helping the World Health Organization raise the $12 billion it says it's needed to create and distribute a coronavirus vaccine. So, two things happening here. World Health Organization holds a press conference, announces the Solidarity Fund to raise all kinds of money. At the same time, FDA giving some flexibility to state departments as far as accelerating their efforts to get a vaccine. And the World Health Organization is partnering up with the World Economic Forum. So think about this. You got the World Economic Forum involved with Event 201. You got the World Health Organization running the response and raising money for vaccines, partnering with the United Nations to also work with the private sector to raise $12 billion to create and distribute a coronavirus vaccine. And this is part of Business Insider's Better Capitalism. But the task force called the COVID Action Platform was created following a World Economic Forum conference call of more than 200 leaders from around the globe. Again, Alphabet, NASDAQ, KPMG, HP, Volkswagen, Bank of America, and Deloitte. The group's main goals are to ensure global supply chains of key commodities remain intact, facilitate business donations to public health needs, develop vaccines. And again, they couch this stuff. You have to understand how they work. They're going to couch it in language that makes them sound like they're just the Avengers here to save the day and raise money. Batman and Iron Man got together with their billions of dollars and decided they want to save the world. I don't think so. Klaus Schwab, founder and executive chairman of the World Economic Forum, says COVID-19 is causing health emergencies and economic disruptions that no single stakeholder can address. Our best and only response is it should be a concerted action. COVID Action Platform is the center of our mission, and we draw upon all members and partners, communities, and capabilities to make it a success. Immediate plans the task force will tackle include the global shortage of face masks. The World Health Organization estimates that there will be soon a shortage of 89 million face masks. The WHO estimates $2 billion in funds are needed for the creation of a coronavirus vaccine and another $10 billion for the distribution of that vaccine. So trying to raise $12 billion as quick as possible to get this vaccine out there. And of course, leaders from the World Economic Forum, the international organization that convenes world leaders in Davos, Switzerland every year, said the platform is open to any and all business or stakeholders looking to get involved. And they talk about they don't want to rely only on the public sector, that the governments are taking mandatory quarantines and states of emergency, but they need to work with the private sector to help get this done too. We can't just rely on the governments. We need the billionaires funding this vaccine effort as well. All right, and this is being reported in a few places. You can see World Economic Forum sets up COVID Action Platform to tackle pandemic, and they'd always make sure to mention the vaccines as a big part of it, and that they need to work with the private sector. So that's kind of where we're headed, guys. This is what is going on. Now, just as we're going through this, now here's the actual COVID Action Platform. Now I want to show you this video from the World Economic Forum that describes what their goals are. So check this out, and I'll be right back.
We face a global health emergency. The unprecedented spread of COVID-19 is disrupting lives and economies in every part of the world. It will impact every one of us, and the sum of individual actions won't be enough to stop it. Gathering actors from the public, private sectors, and civil society to work towards a common goal has been at the heart of the World Economic Forum's work for almost 50 years. This is why we are launching the COVID Action Platform, a unique coalition that will address the crisis in 3 main ways. First, activate the global business community for collective action by improving coordination between them and sharing insights and best practices. Second, protect everyone's livelihoods and ensure business continuity by sharing the latest tools to assess risks, maintain operations, and protect employees. Finally, engage business for the COVID-19 response by strengthening the supply chains for medical equipment and funding the development of vaccines, treatments, and cures. There are many ways you can contribute.
All right, I wonder how much this younger sounding person, voice actor, got paid to do this, and if they know anything about anything while they're sitting there reading this script. But of course they mentioned the vaccines. COVID Action Platform. Dramatic spread of COVID has disrupted lives, livelihoods, and communities, businesses worldwide. But the sum of many individual actions will not add up to a sufficient response. Only coordinated action by business, combined with global, multi-stakeholder cooperation at exceptional scale and speed, can potentially mitigate the risk and the impact of this unprecedented crisis. It's like they had all these webs. I mean, isn't it amazing that overnight, I'm not saying they don't have money and they couldn't make some shit happen really quickly, but obviously we know Event 201 was a planned thing, and all of a sudden they got all these plans. They got a website nice and fancy up, and they're drawing up ideas. And now probably the most interesting part, though, here, in this context, the new COVID Action Platform will focus on 3 priorities: galvanize the global business community for collective action, protect people's livelihoods and facilitate business opportunity, mobilize cooperation and business support for the COVID-19 response. Now, this little map here is pretty interesting. It says it was created by Strategic Intelligence, and I haven't looked at it yet. I wanted to do this live while I'm recording this with you guys to look at this together. So this is intelligence.worldeconomicforum.org, and this is apparently how they're going to deal with all the different problems. And you can click on the key issues: avoiding infection spreading, finding a vaccine, impact on travel, impact on trade, impact on markets. So let's just see what they have in mind here. I wish we could see this image a little better. COVID-19, finding a vaccine. Let's see if we can get this. I don't know how the hell this works. But so finding a vaccine, media, entertainment, global health, justice and law, biotechnology, innovation, human rights, insurance and asset management, corporate governance. So there's so many different pieces here. And I imagine if we really tear through this and look at what they're predicting or claiming is going to be the impact on travel, like you can see Australia, geopolitics, arts and culture. This is a mine, I would say, of a gold mine of information for what these people are thinking, possibly predicting, telegraphing, as they like to do, sort of telling the people of their plans right in front of their face. So let's just see what it says under finding of vaccines. Efforts are underway to identify a means to quell COVID-19. Following the outbreak of a strain of the swine flu virus in 1976, public health officials in the U.S. worried that they were faced with a repeat of 1918 Spanish flu that infected nearly a third of the world's population, and hurried to identify a vaccine. Now hold on, guys. I just got to pause this real quick to show you something. This is a video I stumbled across in the last couple days, and apparently it just got uploaded on Call to Decision Bible Studies. I don't know anything about this channel, this person, whatever, but I'm thankful to them. And if you look at it, it says this is a 60 Minutes episode from 1976 on the swine flu pandemic, which was Mike Wallace. This guy, Mike Wallace, he's a journalist, and he was a great journalist. But they interviewed the head of the CDC. You just got to watch it, guys. I wish I would just sit here and watch the whole video with you, but I don't want to make this video longer than it needs to be. But if you do anything, watch this video. Watch Mike Wallace's. It's only 14 minutes long, and share this thing everywhere, because 2 things to note. This video was made 45 years ago, this report, 45 years ago in 1976. It's so crazy to see how much mainstream media has devolved, that there's not a single journalist willing to question the vaccine manufacturers, willing to question the CDC or any of this. And Mike Wallace does a great job of calling it out, because look, we'll go right back here. Remember on this site here. Excuse me, where were we? This strategic intelligence diagram, which is coming from the World Economic Forum website, where they're talking about the COVID action platform right here, right? So this is their plan for how they're going to handle finding the vaccine. And here under vaccine, it says, following the outbreak of a strain of the swine flu virus in 1976, public health officials worry that they are faced with a repeat of the Spanish flu of 1918 that infected nearly a third of the world's population, and hurried to identify a vaccine. The predicted epidemic never materialized, and hundreds of people vaccinated that year developed a serious adverse reaction. So they at least admit that. That history informs the way researchers and officials now take a generally cautious approach to vaccine development. The World Health Organization has taken pains to communicate to the public that existing pneumonia vaccines do not protect against any protection against COVID, and that it requires its own vaccine. So, anyways, they at least acknowledged that there was an adverse reaction. I'm surprised they even do that. But this report here with Mike Wallace, it interviews a woman and her husband who went and rushed out to get the vaccine because they were told the swine flu was going to be a pandemic, and everybody was at the stores shopping and buying everything and going crazy. And she ends up getting partially paralyzed. And at the time, they're saying at least 4,000 people were affected adversely by this vaccine. And he interviews the head of the CDC. He interviews, a doctor involved. I mean, it's just great. You're never going to see this kind of journalism on TV ever again in the United States unless we overthrow the government and get rid of their corporate partners in media and something new gets established. Other than that, you'll never see this again. But just check out this quick little intro.
The flu season is upon us. Which type will we worry about this year? And what kind of shots will we be told to take? Remember the swine flu scare of 1976? That was the year the U.S. government told us all that swine flu could turn out to be a killer that could spread across the nation. And Washington decided that every man, woman, and child in the nation should get a shot to prevent a nationwide outbreak, a pandemic. Well, 46 million of us obediently took the shot. And now 4,000 Americans are claiming damages from Uncle Sam amounting to $3.5 billion because of what happened when they took that shot. By far the greatest number of the claims, 2/3 of them, are for neurological damage or even death, allegedly triggered by the flu shot. We pick up the story back in 1976 when the threat posed by the swine flu virus seemed very real indeed.
This virus was the cause of a pandemic in 1918 and 1919 that resulted in over 500,000 deaths in the United States, as well as 20 million deaths around the world.
See how easy it is to...
Thus, the U.S. government's publicity machine was cranked into action to urge all America to protect itself against the swine flu menace.
Influenza is serious business. During major flu epidemics, millions of people are sick and thousands die. Well, this year you can get protection. The vaccines are safe, easy to take, and they can protect you against flu. So roll up your sleeve.
Just such blatant propaganda. Seriously, guys, I'm going to re-upload this video to BitChute. I'm going to upload it to DTube. I'm going to upload it lots of different places, so it's not just... I might even just directly upload it to our channel. It's interesting. The guy says that, whoever runs this says that they basically got this video off of VHS, purchased the VHS, and put it on YouTube about 10 years ago, and now they just re-uploaded it. Pretty interesting stuff. And that's the woman right there who was injured. At least the woman that they talked to in the story. You see she's like can't walk. She's wearing braces, and she's got braces on her legs. Part of her face is paralyzed. And, I mean, he does a great job of just breaking this down. All right, so back to the thing at hand. I just wanted to point that out because I had just watched that video, and I was going to share it with you anyways, and they're bringing up the outbreak of a strain of swine flu. And, again, if his report shows that there was no pandemic. And I'm not saying there's no pandemic this time. My mind is still open to it. But I know people have gotten sick. I know people, are ill in different ways, and at the same time, what is real, without a doubt, is the effects, the lockdown that we're seeing, the push for mandatory vaccinations. So, Gilead Sciences, the maker of Remdesivir, plans to recruit thousands of patients diagnosed with COVID-19 to try and determine whether multiple doses of the drug can reverse the infection. Meanwhile, Japanese drug maker Takeda had announced that it will attempt to develop a drug to treat people infected with coronavirus. GlaxoSmithKline is lending its technology to a Chinese biotech company to work on developing a vaccine. Johnson & Johnson is working on a vaccine that would trigger an immune response without causing infection. Trigger an immune response. I don't know about that. And Sanofi is taking an approach that involves using coronavirus DNA to prime a person's immune system without making them sick. Right. The ultimate availability of any successful treatments that are identified may depend on domestic politics. And for example, Democrats in the U.S. have pushed for rules to ensure their vaccines will be affordable, and the Republicans have expressed concern that price controls might discourage companies from aggressively pursuing a solution. Oh, God, guys, I don't know what's going on, but all I can say for a fact is do not take this vaccine. And probably saying that soon will get us banned off the internet, but do not take this vaccine. Do not take this vaccine. Whatever you do, do not take this vaccine. Now, let's look under this World Economic Forum, global governance, right? I have to log in if I want to see that. Unfortunately, I can't just look into that one. You have to log in and sign up. Well, let's see. Impact on travel. Let's check that one out. Demand for air travel evaporated and new border controls emerged as coronavirus spread. So they're predicting, they're talking about what's already been happening. Trump on March 11, 2020 announced a ban on travelers from 26 countries. Within Europe, the spread of coronavirus has tested a core belief in fluid cross-border travel and trade. It has also drawn a line under the European Union's inability to control a policy where most authorities reside with national governments. Spain canceled air travel to and from Italy, and the Commission acknowledged that while it can issue opinions, yada, yada, yada. So, I don't know. You guys look into this further if you want to. I will be spending some more time on this. I think it's worth it because if you look, like I said, they're talking about the impact on travel. They're talking about the impact on trade, finding a vaccine. Like, there's a lot of different points to this. Global health. Let's look at the biotechnology aspect of this. Can we see this one? Nope, they've got that one covered up as well. So my point is, this is the World Economic Forum's plan, though. We need to be looking further into this. World Economic Forum says reshaping global value, COVID-19 implications, and building supply chain resilience. This is also coming from their website right over here under related projects. I looked this up. I looked up this one, preparing for the future of work, which is right here, and then also reshaping global value, COVID-19 implications, and building supply chain. I think we need to be studying what they're putting out right now because they're telegraphing what they want to do and how they would like this to go. And we know that the Bill Gateses of the world are involved in funding this, the Googles. Of course, Bezos is out there promising he's going to save the world. Preparing for the future of work. How is work going to change in response to COVID-19? Curating action for systems of change. We need to look into all this stuff. I also saw this one from the World Economic Forum. 3 ways the coronavirus pandemic could reshape education. And basically what it comes down to is they're saying that there's going to be new digital solutions for education. And they're talking about how the education system is slow, it's entrenched institutional biases and outmoded classrooms. I agree on that. And that COVID-19 has become a catalyst for educational institutions worldwide to search for innovative solutions in a relatively short period of time. What do they mean by that? Well, of course, they're talking about how students are staying home and they're using the internet. Obviously, that's a beautiful thing. Forget the state-run education systems, but just because you're on the internet or using computers to educate yourself doesn't mean you're getting a quality education, especially if you're going to follow the recommendations of the World Economic Forum, the World Health Organization, the United Nations, etc. And of course, they say, with 5G technology becoming more prevalent in countries such as China, US, and Japan, we see learners and solutions providers truly embracing the learning anywhere, anytime concept of digital education in a range of formats, from live broadcast to educational influencers to virtual reality experiences. So they also say that public-private educational partnerships will grow. Again, which when you see this, the public-private could be a good thing if you think of like the state working with some corporations to fund good projects. But what that really is, it's corporatism. It's the statism, and corporations. It's not, some mom and pop people with their the best, like, our interest in mind. It's them coming together to fleece the people and to push forward their agenda. And they talk about the digital divide widening and worsening because of COVID-19. So my point is, this thing has been going on for it happened in December where the first cases were reported. Let's imagine that the Chinese were lying and that's worse than we're being told as far as reporting goes. And that means it could have been back in October, November-ish, maybe already be spreading. But I'm going to say not, because we had Event 201 in October. So I would imagine that, sure, and that's also when the military world games were taking place. So I would imagine it started spreading around then. Then the world started talking about December, January, February, March. We're less than 6 months into this thing, and they're already talking about reshaping education. We're also getting reports. I saw one from The Independent saying that the real concern is that COVID-19 is going to bankrupt much of the world. It's going to bankrupt more people than it kills, and that's the emergency that people need to be worried about. Now, here we go as well. Just a few days ago, The Verge, tech companies are getting more aggressive to fight COVID-19 hoaxes, and it's about time, says Casey Newton. Somebody should go tweet at her. Goes into this just saying that there are big tech companies and social platforms are taking meaningful action to direct people to timely, accurate information about the virus. More than a week ago, Facebook began inserting a box into the news feed directing users to the CDC page about this. Of course, and listen to the way this bullshit's written. With the virus box, Facebook put a rare algorithmic thumb on the scale, presumably driving many millions of users to reliable, vetted information from an authoritative source. They got to say that. It's reliable, it's vetted, and yes, the CDC is authoritative. Don't question it. Tuesday night, Zuckerberg said the company would grant unlimited free ad credits to the World Health Organization to promote accurate information. They will also remove, quote, false claims and conspiracy theories that have been flagged by global health organizations. Kind of like they talked about in Event 201, how they talked about censoring people on the internet who are spreading, quote, disinformation. And guess what? There is a lot of disinformation going on right now, playing right into the hands of these people. Twitter has their own measures. Google's got measures going on. Microsoft, Pinterest, YouTube, WhatsApp. Everybody's censoring things, right? Yay! Just like they promised in Event 201. So to recap, guys, Event 201 has now gone completely public. The World Economic Forum is acknowledging that they ran an exercise. For those who might have thought it was a conspiracy theory, it's not. You can send this to your friends and say, look, they're acknowledging that. Of course, you need to show your friends that the actual videos show much more. In the Event 201 video, it's some marketing video that's trying to make it sound all nice and positive. They don't mention the censorship. They don't mention possibly locking and arresting people who don't follow the mainstream narrative, who post, quote, disinformation. They don't mention any of that. So that just came out on Friday the 13th. The World Health Organization had a press conference where they announced the COVID-19 Solidarity Fund, where people can raise money to help them get vaccines together. They're trying to seek $12 billion. The FDA is giving more leeway to local state departments to start raising money and to start preparing for vaccines as well. The World Economic Forum and the World Health Organization have now launched the COVID-19 Action Platform involving Alphabet, Bank of America, HP, and lots of other big companies. And of course, we can expect Bill Gates to be involved in that as well. The COVID-19 Action Platform, which you can find on their own website, and you can find their little marketing video that discusses, of course, that they're trying to raise money for vaccines. I also will include this Mike Wallace report that, again, I highly, highly, highly recommend watching this 14-minute video. You would not spend 14 minutes doing something more important than watching this video today. I guarantee you that. And we can also, I want to recommend everybody go back here, study this strategic intelligence graphic. This is coming from the World Economic Forum's page. All these links, the COVID Action Platform, scroll down here. Open this thing up, start looking through there, guys. There's lots of details in there. I don't have the time at the moment to look into it, but this is supposed to be a collaborative effort anyway, so let's do this research ourselves together. And as I said, we're looking at a situation where things like education are already being reshaped because of this. But the grand push is for censorship, complete censorship, since they've spent the last couple years deleting independent alternative media channels and blocking us and censoring us. Now they can spread whatever propaganda they want about pandemics, about viruses, about vaccines. They're going to push for a global vaccine. They're going to push for global governance as the proper response and way to handle this. The messaging is all there. It's becoming very clear. The Event 201 is unfolding right before your eyes, and the end result will be a call for global government. That is it. That is what's going on. Now, you can say We still need to do more research on whether or not the virus was engineered in the biolab in Wuhan, if it was released by the Chinese, or if the Chinese and the Iranians and the Venezuelans are right and it was released by the U.S. during the World Military Games. But at this point, guys, we don't know. All we know is this. The world economy is going to be affected, is already being affected. The Federal Reserve just bailed out this system again, pumping more and more fake money into the system. They are preparing for a potential economic collapse. And for those who look into this, I mean, I recommend checking out Ice Age Farmer. I just want to say that he's a good channel. Been checking out his videos focused on some of the agricultural side of things. Guys, this is why freedom sells. This is why permaculture is extremely important. This is why learning how to take care of yourself is more important than ever, okay? I need you guys to recognize that. It's time for you to take serious the solutions that I put forward. Go visit freedomcells.org, freedomcells.org. Watch our Freedom Cells playlist. Start learning about growing your own food, permaculture, unplugging from these systems. Yes, now it may be a good time to stock up, because if this shit does get worse, it might last through the summer. It could go away and then get bad again in the fall if the virus comes back once the weather gets cold. At this point, we don't know. But the point is, it's always a good idea to be prepared. And if you haven't been taking the situation seriously, hopefully you are now. Because I am. Not because I believe everything that the mainstream media says, like some of you idiots want to say, but because I see the real outcomes of where this is going. And I'm not going to be held down and vaccinated. I'm not going to be quarantined. I'm not going to be stuck in some freaking medical martial law, but that's what's coming. This is either a test run or this is the real deal. Either way, you better get your shit together. Until next time, remember, you are powerful, you are beautiful, and you are free. Peace.